All right, for those of you who have ever met me and you've heard my story, I've talked about having chronic migraines. It was a terrible experience, and I don't recommend it at all. So, for those of you who have migraines, you're nodding your head in agreement, right? You know exactly what it means to have a terrible migraine. Migraines are a neurological condition, and they are marked by symptoms that include pain, but not limited to just a headache. So, when people say, "Oh, you just have a headache," and you want to, of course, roll your eyes, but you're trying to be nice. Instead, you know that migraines have a lot of neurological symptoms. So there can be nausea, dizziness, irritability, um, pain in other parts of the body, such as the abdomen. There are abdominal migraines. Migraines can have vomiting associated with it. Or in my case, I had total blindness. I would completely lose my vision when I had severe migraines. And for many of you, migraines last for maybe just 15 or 20 minutes. For others, it could be hours. And for some, such as myself, I had migraines that lasted days and weeks and months at a time. I was in pain and I had neurological symptoms associated with migraine that lasted for the better part of 10 years. So, finding relief from chronic migraines can really help with your life, both your mental and physical well being. Because when you're in pain, of course, you're carrying yourself in a certain kind of way. Your body may be locked up, you may have your neck tightened up, and you could be stiff. And what that does is it can change the alignment of your spine, the ways your muscles are increasing in activity by trying to hold your body in a certain posture to prevent pain. And you may find that you have a lot of muscular discomfort or fatigue. And for me, I had significant and severe neck pain as well as having my migraines. So, if you are having severe migraines, chiropractic care can definitely help. And I've talked about this before. Simply by adjusting the spine, it could relax the muscles that are trying to hold your neck tight or whatever, wherever you're holding pain in your body. So, chiropractic focuses on that spinal adjustment, that spinal alignment, decreasing muscle tension, and increasing nerve function. So, as you know, when you have subluxations, meaning that your spine is maybe pressing a little bit on the nerves, and that can really increase pain for people who have migraines. So, chiropractic care can help to alleviate some of these symptoms. So, migraines can be greatly helped by chiropractic adjustments, but in addition to that, you can take into account other factors as well. So, dietary adjustments. For me, when I had severe migraines, there were a lot of foods that I could not eat. They would simply trigger migraine. So, for example, caffeine was a migraine trigger for me. For other people, it was a solution. But for me, it was a migraine trigger. In addition to that, anytime I had chocolate, unfortunately, that would trigger a migraine. Or alcohol. Alcohol can be a significant trigger for people with migraines. So as you are eating and are having a migraine or don't have a migraine, be mindful of what's triggering it. So, for example, tomatoes would trigger migraines for me. Tomatoes did not trigger migraines for a lot of other people, but for me, they did. And so once I eliminated the triggers based on different types of food that I was eating, and those foods, once they were eliminated, they would eliminate some of the triggers. Migraines can come on at any time, and the triggers can be many. It's not just food, but it is something to consider when you're trying to help yourself or trying to relieve yourself from migraine. Other things that contributed to migraines for me had to do with the fact that I had a little bit of arthritis in my neck from being an athlete. So when my neck would be in pain due to extreme cold, so when I was out in the cold weather, or there was just a massive variation in temperature, such as when I lived in Phoenix, there were temperature fluctuations of up to 40 degrees. So when the weather would change, I would find sometimes that it would trigger the nerves to act a certain way. My neck would tighten up, and then I would get a migraine. And what I discovered was by choosing to live in another location, I moved to Hawaii for that very reason, so that the weather here is extremely stable. And once the weather was stable for me, I had fewer migraine triggers. So pay attention to how the atmospheric pressure, the barometer, how rain coming in, rain leaving, or hormonal fluctuations are maybe impacting your body. And that could be a way for you to identify what triggers migraines for you and how to alleviate that trigger prior to it even happening. That way, you can stop a migraine before it even starts.